Welcome to all our listeners. My name is Leena Wadia. I'm a physicist by training, but I have worked in education for more than 15 years now, and I serve as the Dean of Education and Outreach at TDU. And today I'm talking to Dr. Girish, who's an Ayurveda physician. He based in our hospital. The hospital is called the Institute of Ayurveda and Integrative Medicine. It's a charitable research hospital, NABH accredited, and it is attached to our university. So the university and hospital work very closely together. Dr. Girish's work also reflects that he's not only an Ayurveda physician, but he's also deeply involved in education and particularly education in Panchakarma. So I'll invite Dr. Girish to introduce himself. Tell us a little bit about yourself, your training, how long you have spent at Institute of Ayurveda and Integrative Medicine, and so on. Please go ahead.
Namaste, and thank you, Leena Madam. It's my pleasure to having interactions at this point and to share about myself and the program and mainly about Ayurveda and Panchakarma.
Mm-hmm.
To begin with, I've done my BAMS, which is Bachelor in Ayurveda Medicine and Surgery, which is a bachelor degree in Ayurveda. And then I've done my MD, which is master degree in Ayurveda Dravyaguna. Dravyaguna basically expands as medicinal plants or pharmacology or anything related to the pharmaceutics, all these things.
Mm-hmm.
That was my medical degree. But when I joined TDU or IAIM, it was just FRST, which was 15 years back, 2010, May 21st. Apparently, just 3 days back, I finished my 15 years long journey.
Right.
And I've been very, very inspired, motivated, active, and also happy at after all this 1.5 decades of journey with the organizations.
Mm-hmm.
I've seen the organization growing from an NGO to an institute. That's where it became IAIM as a whole. Then it becomes gave up a title as University TDU.
Mm-hmm.
I've been fortunate and thank you that I've been holding a faculty position as TDU and also working at IAIM as a clinician. And with this both as a platform, my academic outreach, which is academic training programs, also been flourished well. So it has given me multiple opportunities to showcase myself in a wide spectrum. That's one word. Then in the journey, I started as a curriculum developer initially to begin with. So wherein I was asked to develop a curriculum for a innovative audience or innovative subjects. So it was example, medicinal plants and primary healthcare was my first topic given to me to develop a certificate, diploma, and any kind of programs, workshops and all in that area for the self-use, self-reliance of health, primary health, basically. How do you use medicinal plants or the plants that is available or accessible in and around your place? Example, it can be pepper or ginger or maybe a tulsi plant, ajwain plant, all those things, and some which is accessible to by nearby. Like maybe you can go and buy some triphala or ashwagandha from a local grocery shops, or maybe the medicinal plant or plant products available somewhere else. Or you can go nearby to the garden and you can pluck some plants. How do you, once anyone like an household person, as a college student, or maybe an ASHA worker or anyone, so who wanted to self-reliance and also help the first level of accessible people like family members or the community people. So how do you take care of primary health care? So here, basically the background is we always rely on doctors or a pharmacist. So we have a cold and cough or a fever, immediately we go to the pharmacy shop and ask for a tablet. So then he give maybe randomly or by his own logic, he gives some medications. So we are dependent on medications rather than of self-healing, self-reliance. So what Ayurveda says and what our tradition also says is observe yourself, okay, and be aligned with the nature, and also use the nature for yourself. So that's where the one of the key principle of Ayurveda, which is Loka Purusha Samyata and Samanya Vishesha Siddhanta. So these two fundamental principles of Ayurveda or our traditional healing systems says that you look at your nature, internal and external nature, and balance yourself. So that's a very, very simple and broad word. To this implement at a layman level, this program was unique one, and which was very much accepted. So I did my curriculum developing programs and designed 3 days, 5 days workshop, and also a 6 months and 1 year diploma. And we trialed it. We trialed it on various people, like people who were approaching our institution for their self-learning in the primary healthcare aspects. So we conduct workshops for them, training for them, talks, seminars for them, and also tie-ups with some colleges like Mount Commerce College, then the Christ University. We had a regular tie-ups. For a few years, we did the courses, credit courses, and also a PG diploma at Mount Commerce College. This was my initial experience. Then with this opportunity expanding, I used to get students from across India or abroad as well to learn Ayurveda. And the individual person's perspective was unique. So I wanted to learn some other aspect of Ayurveda, like Panchakarma. Some wanted to learn about medicinal plants in Ayurveda. Some wanted to learn basic principles, fundamental understanding of what the philosophy tells, what the principles underlines. So I continued developing various curriculums, why I'm calling curriculum, because it's not only about the content and how to deliver the content, that altogether becomes a curriculum. So I evolved as a innovative curriculum developer over the course of 10 plus years. In the journey, I got an opportunity to uplift and continue the Panchakarma Therapist Training program. That's how I got into this Panchakarma training. Panchakarma training was happening before I joined the organization. It was started in 2008 when our IAIM hospital, which is now an 100-bedded hospital, which was started in somewhere 2002-3, when I was not there. I was told that as a 20-bedded Amrut nursing home. That was the initial name. Then obviously a clinic or a nursing home or an Ayurveda hospital means you want doctors, you want nurses, and mainly the Panchakarma therapist, because Panchakarma is a very, very crucial, inevitable part of Ayurveda treating protocol. So they wanted Ayurveda therapists. They used to hire from Kerala, but the need came in that let us do a training program at in-house. So that's how initial curriculum was drafted. From 2008 onwards, there was some support from the Northeast Council to train around 60 students of Northeast. So that's how the program got initiated by some kind of a external fund and identify the student from the Northeast. That's how I have been told previously. Then the 3 batches of 20 each was conducted. Then there was no fund, external fund. So that's it. And anyway, curriculum is there to some extent, which was piloted on 3 batches. Then it was opened of students who wanted to take over. Since this area, which is again niche, which is again unique, which is not very commonly known for the common people. So that's even today it is up to some extent, but still it is under the dark only. Okay, area as an direct career opportunity is not known much to a common man. So in 2009-10 and all, there were no takers. Okay. Then the team which were handling this education program or the Panchakarma Therapist Training program had some challenges, and there were no batches happening in 2010 and 11 also. That's how when the team got dissolved and the program is still existing. So I had opportunity. I was asked to, do you want to take over and upgrade the program or uplift or rejuvenate? So that's how I took over this as an additional program apart from what I was doing as a curriculum developer. So since academic and curriculum developing training, this was my key area at that time. So I was given the opportunity to look into it and see what best we can do. And
Thank you. Dr. Girish, before you go forward, I wanted to highlight to our listeners, because you have mentioned medicinal plants and FRLHT and so on. So just for their understanding, I just wanted to mention that every university is set up by a trust or an NGO. And our trust is known as the Foundation for Revitalization of Local Health Traditions. If time permits, I'd like you to talk more about FRLHT also. That's the acronym for the NGO. And the hospital was started first, actually, before the university. The hospital, as you say, was started quite early in the early 2000s. And then the university, but I think it was registered in 2011, maybe.
13.
And, yeah, and then the university was launched, legislated by the government of Karnataka in 2013. And now today the university is the dominant entity and the hospital is attached to the university. And we are doing integrative medicine, and it's kind of good to explain what integrative medicine means, which is that we are using modern biology and all its tools, the lab techniques, the sonography, the cardiograms, everything for diagnosis, but the treatment is with Ayurveda. Am I correct, actually?
Yes, yes.
Yeah. So that's where we are. And Dr. Girish has just given you a very beautiful historical picture of how he was entrusted with the task of training in Panchakarma. So I want to ask you, Dr. Girish, is this so tell us about the scope of Panchakarma, the word and the scope of it, both in wellness and in both for wellness. You already mentioned how people can take care of themselves, using medicinal plants, which is an area of specialization of FRLHT and us. So for wellness as well as for illness, curing illness. So promotive and curative. So please tell us. Yeah.
Thank you. So to better explain the scenario, if I can tell you directly the answer, it will be a very simple answer, but I would like to tell you about the background for that answer and the logical explanation about the role of Panchakarma in wellness and also illness. So, so first of all, we should understand the concept of health and looking at concept of health through Ayurveda perspective, Ayurveda vision. So Ayurveda clearly says health means the balanced state. The balanced state of doshas, that is samadhatu, samadosha, samadhatu, which is balanced state of tissues, balanced state of the metabolism or the conversion factor happening in our body, which is very important, that is Agni, and the balanced process of excretions, which is the waste. So here the four entities, the physiological functions, which is named as doshas, which is Vata, Pitta, Kapha, should be in balanced state. Then the Agni, the metabolism, should be in a balanced state. Tissues, which are the body pillars, the pillars are the body made up of the tissues. They also should be in a balanced state. And the excretory functions, when there is something input, the output also should be in a balanced way. So that's where excretory functions. These are the four physiological and also the quantifiable parameters. They should be in a balanced. And not only them, but also our senses, which is called indriyas, and manas, which is our psychology, psychic state, okay, and also the atma, which is our soul. These also should be in a balanced or more prasannata or what you call contentment or the satisfiedness. So that's a wide definition of health.
Mhm.
So why I'm telling this? Because from an illness to the wellness, in between is that health. So when you have lack of health is what the illness. And when you want to improve that health is called wellness.
Mhm.
That's where health definition we need to understand.
Mhm.
The prime factor in these 7 parameters, which is 4 objective and 3 subjective parameters, the prime is the first one, which is called dosha, Vata, Pitta, Kapha.
Mhm.
And this is very, very dynamic. Hence, it's called dosha. Means they are always keep in a fluctuating mode. So, example, now we are in Bangalore, there is some kind of a rain and there is a little coldness is happening. 1 week back, there was sudden hotness was there. That summer was peak. So, what because of the heat outside, there will be internal influence. Your pitta will be high. When suddenly the heat goes down and the cold increases, then the pitta will go down and vata will increase.
Mhm.
If too much cold with too much unctuousness, then the kapha will increase. So this is happening on every second, every moment in the body and outside the body. It is called dynamicity of the nature. So that dynamicity of the nature is measured, assessed in 3 terms called Vata, Pitta, Kapha. That's a very, very unique concept of Ayurveda, very, very subtle concept of Ayurveda.
Mhm.
So what I wanted to deliver is this Vata, Pitta, Kapha, which is very, very fluctuating, very, very dynamic,
Mhm.
are responsible for functions of the body, for
Mhm.
for the balanced function. Okay, in a unique example to explain this, Ayurveda says, like life existing on the earth because of sun, moon, and air.
Mhm.
On the earth, the sun influences, moon also influences, and there air which is always mobile, which is balancing the heat and cold.
Mhm.
Because of 3 factors, the life is still existing and self-sustaining. That's what the explanation. Similarly, in the body, the air is compared to vata, the sun is compared to the pitta, and the moon is compared to the kapha. So when
Mhm.
these 3 vata, pitta, kapha is balanced or self-balanced, not balanced always with 33, 33, 33, but self-balanced in an individual, then it is a health status.
Mhm.
Okay. Due to the whatever we consume, there is increase in our body or decrease in our body, what in the vata, pitta, kapha. So every moment I speak, I eat, I drink, or I walk, I jog, I sit quiet or asleep, all these are in a fluctuating mode.
Mhm.
in a in a scenario where there is slight imbalance or it is not balanced. Okay, example, we consume food when it is not supposed to consume, or we don't consume food when it's supposed to consume. We sleep when you are not supposed to sleep, and you don't sleep when you are supposed to sleep.
Mhm.
This is the imbalance we do ourselves.
Mhm.
Okay, with this what happens is there is some imbalance in vata, pitta, kapha.
Mhm.
They are the factors which will lead into a disease.
Mhm.
Now panchakarma comes here to balance that vata, pitta, kapha,
Mhm.
yeah, in the illness factor,
Mhm.
yeah, and bring back the vata, pitta, kapha in well. So that's a very, very simple example where I'm giving you the role of panchakarma in the illness.
Mhm.
When the wellness, same vata, pitta, kapha will be in a fluctuating, but as a course of period, like we are aging, our hair is becoming white. As the aging, there will be wrinkles. So
Mhm.
similarly, in a seasonal changes, where is various season influences our body, there is this influential vata, pitta, kapha becoming imbalance. So Ayurveda says Rutu Panchakarma, seasonal Panchakarma. If you undergo Vamana, which is emesis, is one of the Panchakarma, in the Vasanta Rutu, which is spring season, you are not likely to get a disease in next 1 year, kapha related problem.
Mhm.
If you undergo a Virechana, which is loose motions, in the Sharad Rutu, which is in September, October, November, in the autumn season, then you are not get a imbalance in the health due to Pitta in the next 1 year.
Mhm.
Similarly, in the Varsha Rutu, which is rainy season, which is somewhere now June, July, August period, if you undergo one course of enema, which is
Mhm.
called as Basti, the
Mhm.
Vata will be in balanced condition, which will be supporting your body for next 1 year.
Mhm.
So that is the role of Panchakarma in keeping your health, not to get a disease.
Mhm.
So similarly, expansion of this Panchakarma, there are various methods of rejuvenating your body, like massage. The entire body you are going to apply oil application. Ayurveda says that if you do an oil massage on a regular basis, which regularly as daily or weekly or some 15 days on fortnight or monthly, etc., your body becomes more strong. How? By improve the circulations, by creating unctuousness in the between the cells, and there is even balance of cellular exchanges in the body, and the excretions have been facilitated out. So with this process, Abhyangam acharet nityam sa jara shrama vataha. Your old age can be postponed. Means your aging process can be postponed. So that's a very important factor for wellness.
Mhm.
A simple tip for a wellness is you keep applying oil for your body on a regular basis. You can push your health in a better state and push back the aging process. Okay,
Mhm.
so that's one example. Similarly, there are many such Panchakarma practices which can be incorporated to improve the wellness.
Mhm. That's a beautiful answer, and there are so many questions that fall out of that. One word I didn't understand. It's you use the word unctuousness. What does that mean, actually?
Stickiness,
Ah,
or something which is heavy,
ah,
and means we consume some kind of an oily item or sweet items.
mm,
Okay, with the cold, then the kapha increases.
mhm,
Okay, like example, if I consume curds when there is a cloudy day, and I consume the curd, which is very cold and also sticky.
mhm.
So that's where the kapha increases.
Got it. Got it. Yeah, yeah, yeah. But so tell us a bit more about Panchakarma and how people can do this self-healing which you talked about. I mean, looks. I mean, it's clear that Ayurveda has very well laid out principles, but most people don't know it, right? So what is it that individuals can do to help themselves? And we don't even know whether when Kapha or Vata is out of balance. So what are the guidelines for people to kind of what is it that they can do to benefit from these principles that you just outlined?
Yes, yes. So we have to educate people.
Mhm,
Like we are educating children at a
mhm,
young age, ABCD or the
mhm,
mother tongue language. Then
mhm,
also we educate them on the mathematics, 2 1s are 2, 3 1s are 3,
mhm,
etc. Similarly, we also educate them on the chemistry about the hydrogen molecule, oxygen molecule. We should also educate on the Ayurveda. So that's a
mhm,
one word I will tell. I always keep telling that Ayurveda education should start at a primary level. We
mhm,
should make them children to identify the medicinal plants and medicinal uses,
mhm,
to inculcate the use of such medicinal properties of food, rice, or even the pepper or ginger, tulsi. All these are which are accessible, which is irrespective of the religion, which I call irrespective of religion, because health is a religion here. Okay.
mhm,
So
mhm,
coming back to what you asked about, so when we educate people, people can be better relating
mhm,
to their health and also to the nature. Okay.
mhm,
Then it is easy for them to understand Vata, Pitta, Kapha. So
mhm,
that's the one word. Second, these practices, irrespective of the education,
mhm,
was there in our tradition.
mhm,
Okay, what are these practices? I call Ayurveda is as old as mankind. Ayurvedic practices are indigenous to India, and it
mhm,
is practiced daily in daily life in a everyday home.
mhm,
Okay, example: we eat food in our hands.
mhm,
Okay, so that is Ayurveda. Means you taste before you taste by tongue, you taste the food by your hand.
mhm,
Of using the spoon, if you use your hand, that itself is a stimulator of
mhm.
the your physical chemical reactions happens, and it prepares your stomach to secrete the right quantity of enzymes when you touch with your hand
I see.
before you touch your mouth. That's a stimulator. So this is Ayurveda. So
Mhm,
eating food by your hand is Ayurveda.
Okay.
Okay. Second, our practices like putting oil on your head,
Mhm.
not only about hair care, but
Mm.
it rejuvenates and balances the health of your all sense organs.
Mhm.
By science, that head is very, very prime important, and it is the headquarters of all the sensory perceptions. Correct?
Mhm.
You all, not only sensory but also the all functions.
Mhm.
Like pituitary is responsible for all kind of endocrine system. So putting oil on your head,
Mhm.
endocrine system, neurological system, your all sense organs, and local benefit is your hair.
Mhm.
Okay. So Ayurveda says that you apply oil for the entire body regularly, but on
Mhm.
a regular basis, very regular means on a daily basis, put
Mm.
oil for your head.
Mhm.
Shiraha, Shravana, Padeshu tam Visheshena Shilayet. You
Mm.
have to put oil, apply oil for your head and
Mm.
the ear and
Mhm.
the foot
Mhm.
on a very, very regular basis. So
Mhm.
this is the practice of Ayurveda,
Mm.
which was there in our tradition.
Mhm.
Tradition means traded in generation.
Mhm.
The knowledge which is traded from the generation to generation is called tradition.
Yeah.
So the knowledge of business, like banyas,
Mm.
is a tradition. Knowledge of catching fish is a tradition in the fishery,
Mhm.
fishermen. So similarly, in our household, the tradition of health is by eating your food in your hand, applying oil on your head. Similarly, kajal. People used to prepare kajal in their home.
Mhm.
Like, you agree with me that your grandmother would have definitely prepared kajal
Yes.
there at home.
Yes.
So today we are not doing that.
Mm.
Today we are not at all applying oil for your head. Okay, you are not consuming food in your hand. You are using chopsticks or the spoons or the forks, etc. and all. So similarly, all these practices. So Ayurveda and Panchakarma is slightly extension of Ayurveda is the Panchakarma.
Mm.
Altogether is Ayurveda. So these
Mhm.
are the practices which will or which should be practiced
Mm.
keep our health. So
Mhm.
adding on, like oil massage, there is an oil pulling. You just put some oil on your mouth, you hold and you move. If you do this regularly, after you are brushing, okay, your gums are taken care.
Mhm.
Your dentures will stay with you till you stay on the earth.
Mm.
Okay, so this is the best part of Panchakarma Ayurveda, which is
Mhm.
called Gandusha, which
Mm.
is oil holding and oil pulling practice.
Mhm. Mhm.
Similarly, a 2 drops of oil or a ghee into your nostrils, which is
Mhm.
called Nasyam.
Mhm.
Pratimacha Nasyam means every day you put just 2 drops.
Mhm.
So this will take care of the entire this what is neurological plexus and
Mhm.
also the secretory system of the sensory organs.
Mhm.
Okay. There are ifs and buts, or there's do's and don'ts. When you have cough and cold, you are not supposed to do that. Okay, all
Mm.
those things are some exceptions are there always.
Mm.
Okay. But these are the practices for a healthy person.
Mm.
When he is healthy, if he
Mm.
practice, he keeps on boosting his health.
Right. This fascinating stuff. I mean, really. So let's come a bit. So I have this question about, how much Ayurveda education, because, the BAMS graduate, like you said, you study for 4 years, and then the master's is another 2 years, and so on. So what is the scope of Panchakarma, and how is it possible to um, master it in, say, 6 months or 1 year, which is the typical duration of our courses?
Yeah. Yes, just to correct, BAMS is 4.5 plus 1 year, which is 5.5 years, which is as equivalent duration of a MBBS or any medical degree. So that's
Mhm.
a medical position. Yes, as a expert in Ayurveda, which is a doctor level, this 5.5 years is required.
Mhm.
But what the context you just mentioned is
Mhm.
a therapist.
Mhm.
He is like an assistant or a subordinate or the next person, extended hand of the physician. Like
Mhm.
a nursing staff. As we all know, nurses, the profession of nurse and the need of nurse is huge and ultimate. In any healthcare industry and a hospital industry, nurses are the prime factors.
Mhm.
Without a nurse, you can't imagine an hospital. You can imagine a clinic where doctor is giving medicines, but nursing care means the care for the patient. The doctor is definitely, he will take care, but he is the like a master supervisor. But the hands-on caring is done by the nurse. The nurse or nursing, the prime factor in Ayurveda is this upasthatha, is the title given. It's a Sanskrit name, Ayurveda name. Upasthatha means is always present with the patient, caretaker. So he is the therapist. Okay. The extension of that upasthatha or the attender, or we call caretaker, he is the person who will put on hands-on service. And he is trained by the physician to do some extension of the Ayurveda physician's advice. That's what extension is called treatment. So that's a unique molding of this position called as Panchakarma Therapist. They are also the nurses, they are also the healers. So that's a unique blend of the nurse and then heal is the therapist. So to become a qualified, skilled, trained, certified therapist, TDU has developed the program of 6 months and 1 year diploma. 6 months is a certificate and 1 year is a diploma program. Diploma as together is called 2 semester, a long journey of learning the knowledge and also the skills. Knowledge, which is what and why part, and the skill is how part, how to do, how not to do also. So together it is a 1 year long course of diploma. The person who can exit or not can want to exit, or some reason you want to exit after 6 months, TDU has designed a comprehensive 6 months program, wherein with 6 months itself you will be able to treat the patient under the supervision of an Ayurveda physician. Treat here is not individually authorized or certified to individualize the treatment, but under the Ayurveda physician's guidelines, he can deliver the treatments. So he be skillfully expert. But as a journey, if he completes 1 year, then it is better experienced. He can better deliver it, complete skill part of the Panchakarma. So the duration is 6 months certificate program we have, and also 1 year diploma program, which is 2 semester long.
So yeah, so now you've been running this course for quite a long time, isn't it?
Almost 15 years, 14 years.
Yeah. So you mentioned to me that this course, the people who pass out of this course can work also in the wellness and spas and things like that. Please elaborate on that. Please tell us a bit about the career opportunities of people who do this 6 month or 1 year diploma in Panchakarma.
Yeah. First of all, the prime eligibility of this program is 12th standard. Means the person has to be completed his primary education with a grade of 12. 12 pass. As per the Ayush guidelines in terms of academics, so 12th pass person, irrespective of the streams, like it can be a science or commerce, etc. That's an option given by our university, but preferably science is always preferable because he knows the science part of it. He is eligible for the enrolling of this program. But a small extension or the what you call privilege is given for the 10th pass person if he is not able to complete the 12th pass, then, with the consideration of 2 years of either other experiences, but he has to be at 17 years or 18 years age, 10th pass, if he is not completed the 12th, but at least he has done some other things in the 2 years, considering that as experiential knowledge, he can give an entry for the diploma as well. A 10th pass person can easily go for 1 semester and complete. He can't get a diploma degree. Hence, 10th is minimum for the first semester, which is certificate, and 12th is mandate for the diploma. So that's the eligibility. Coming to the scope in terms of career opportunities or the placements, once irrespective of the certificate or diploma, they are well accepted or well received or in demand, or their people are waiting for them to join. That's what I want to tell. In the first Ayurveda, the mother industry, which is Ayurveda clinic, Panchakarma centers, then the Ayurveda hospitals, then Ayurveda-based wellness centers, spa industries, because spa is again the extension of Ayurveda Panchakarma in a little modern, in a more conventional, in a more elite presentation. That's what I can tell. And in more integrated in terms of Western and Eastern styles, all those things mixed together, that's a spa. So there also the same Ayurveda therapists are further molded or further tuned to become a spa therapist. This is one. And parallelly, unsaid, there is an other arena which is Ayush expansions, which is Ayurveda, Yoga, Unani, Siddha, Homeopathy extensions, like naturopathy. In naturopathy institutions, there are a huge demand for our Ayurveda therapists who know the basics of Panchakarma, treatments, massages and all. They are again fine-tuned for naturopathy skills. So the arena is huge, from Ayurveda industry to naturopathy to wellness, purely wellness, and also the spa industries. Okay, all these are the scopes for the Ayurveda Panchakarma therapist, especially trained at TD.
Yeah. Thank you. I mean, I know that the demand for Panchakarma therapists is very, very high and it's not being filled. You have trained several hundreds of students, isn't it?
So to list it out, to some extent, definitely we have crossed the 1,000.
I see. And what is the projection of what the industry needs actually?
Very good questions and very relevant for today's audience. That if you give me 100 therapists on today, within 3 days I can place them.
Wow, that's fantastic. So I think for students considering careers, this information is very, very useful actually, isn't it? Yeah, yeah.
So I am telling this on a background that having being a university and a recognized training center, and been regularly been doing this Panchakarma Therapist Training program, we have been very much visualized by the employers, especially although as I mentioned about the Ayurveda, wellness, spa, naturopathy, the employers, potential employers, have been approaching us. And to have a track of this recruitment process and also to keep aligned. So we have made a very systematic protocol process. We collect the data from the employers, what is they require. Okay. We collect the data of the employer and also what their number requirement, like male therapist, female therapist, and what is their offerings in terms of CTCs, and what is their other privileges apart from the salary. They give food and accommodation, stay, etc. So this is captured through a Google form, Google link form. We'll send out a link to the employers. They fill it up the details, and once we receive the details, we have a Panchakarma placement cell or placement officer is nominated for that purpose. They will communicate and reconfirm the details. So once we reconfirm them, we then announce to our Panchakarma in-house students, therapists, and also the people who are outside. So with this collection, I have at least more than 30 employers waiting for the recruitment, which is a minimum of 2 to 3 people. That's where I'm told the figure that if you give me 100 trained therapists, I can deploy them in a week time. Completely, all of them will get a job with a very, very attractive salary of minimum is 12,000 for a fresher, 15,000 is for the 1 year experienced person, and more than that is based on the experience. Apart from food and accommodation, incentive, and also the additional benefits from the tips, etc.
Tip from the customers and so on. So basically, you're saying that we should target to admit at least 100 students this year, isn't it? Yeah.
And this year, 100 will be less, but anyway, so we have to be contributing to the industry, so we should definitely get more students.
Right. There's something I forgot to talk to you about, which is you had mentioned to me once that students also learn how to prepare Ayurveda medicines or oils and things like that. That's a completely new area for us. Tell us a bit about it. I mean, we might have been to massages. I have, and so on. So they use different oils for different types of massage and things like that. Tell us a bit about that. Actually.
Yeah. So basically, the Ayurveda treatment protocols are all works wonders when you use the fresh preparations.
Mhm.
Fresh preparation means you have to prepare them at the period of when you are deploying the treatment or
Mhm.
within few days. So
Mhm.
generally it is not stored and then it is used until
Mhm.
unless some products which is like a very dry powders which can be stored for 3 months to 6 months.
Mhm.
The fresh preparations which involves a paste,
Mhm.
applying a paste or an powder massage powder combination massage, and some decoctions or some liquids which is prepared to pour on the body.
Mhm.
Example, Shirodhara, the
Mhm.
wonderful treatment of Ayurveda, which you will see in front of any Ayurveda or a spa board. Outside
Yes.
board, there is a like the oil or the liquid pouring on the head, like
Yeah.
in a pot. So that's called Shirodhara Yantra, okay, Patra. And then the liquid is pouring on the head. The Shiro means head, Dhara means the liquid, the stream of liquid pouring on the head. So
Right.
this preparation, except the oil, which is again prepared, it can be prepared in-house or also prepared from the manufacturing end. But some other medicaments, which is poured on the head, are to be prepared fresh.
Mhm.
So the need is to prepare the ingredients or the materials for the treatment at a fresh.
Mhm.
So these are prepared under supervision of an Ayurveda physician, but they are again prepared by the hands of the therapist.
Got it. Yeah. Yeah.
Hence, this therapist has to know how to prepare.
Mm.
So we teach as a part of curriculum to our therapist basic preparation of the basic medicines. So which is like preparing a decoction, preparing a juice extraction from a plant, preparing the paste which is kalka, and preparing the enema content ingredients, which is a combination of a decoction, paste, powder, etc. and all. We teach them to prepare the patra pinda pottali, means a bolus which is made up of fresh leaves which has a pain relieving property, like
Mhm.
the from the calotropus, this is ark bolte, and from the karanja plant, the leaves extract. So leaves from around 5 to 7 varieties of plants which are freshly collected. They are washed cleanly and then they are fried, chopped and fried in the pain relieving oil, and then it is been packed in the clean cotton kora cloth and made into a bolus or a potli.
Mhm.
So this preparation technique is again unique. It is not everyone can prepare it. So that
Mhm.
requires the skills of preparing in a right way. So
Mhm.
that we train. So like this, around 15 to 20 different type of preparations we teach them, which is
Mhm.
very important for the treatment purpose.
Mhm.
Parallelly, we also teach them about self-healing also. Like example, I was telling about the use of tulsi or some etc. Those are the self-healing also we teach them. And
Mhm.
we also teach them identify the medicinal plants, because if they don't know the medicinal plant, how can they choose it?
Mhm.
So for the preparations, so
Mhm.
we teach them the medicinal plants identification, medicinal plants collection, then
Mhm.
convert into medicines, and then do the treatments. So all
Mhm.
together we train in this curriculum of 6 months and 1 year.
Mhm. 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 Thank you for that. I had just one curiosity question with regard to comparison of, say, what happens in Thai spas or what happens in Ayurveda health centers and so on. They use a lot of aromatic material, isn't it? Ayurveda doesn't do that. I mean, is that simply a matter of just using the original material as is without attempting to make it more marketable, or um, what's your thought about, because if you look at the spa industry, I mean, that's about making everything very, like you said, elite presentation. Is there any effort like that in Ayurveda, or should there be? I mean, I don't even know if there should be, and whether if you add some aromatics into the Ayurveda oils, whether that will affect their properties. But I just wondered about whether you have ever thought about this
Yeah,
question, actually.
yeah. So in the textual references of Ayurveda, we don't find the use of aromatic oils,
Mhm.
but some plants as is innate basic aroma.
Mhm.
like if I say we produce around 100 different type of oils in Ayurveda for the use of external, also internal purpose, which can be consumed.
Mhm.
And majority are made with the base of sesame oil.
Mhm. Mhm.
Base is same, but the aroma of each oil is different.
Right, right.
So, but here we are not adding any aromatic by in terms of my name itself is an aromatic oil to enhance the aroma.
Mhm.
The natural flavor is maintained.
Right,
So that each oil is having its own natural aroma, which is
right,
natural flavor. It is
right,
not advised, but it's not practiced. I can say it's
right.
not practiced to add an aromatic oil. So that's a
Got
one
it.
thing about the base.
Mhm.
With respect to having aromatic oils, it is a momentary pleasure.
Right.
Like if I enter into an hotel and I feel something which is more elegant smell is the favoring smell, because here it is more contextually, it is not only to enhance but also mask something else.
Mhm. Mhm.
In fact, to tell you that in our traditional practice also, many people, including men or female also, they wear garlands.
Mhm.
Yeah, and it's also linked with some auspiciousness that without the flower you are not supposed to enter to the temple, etc., etc. But
Mhm.
what I believe is male or female
Mhm.
having the garland was our tradition,
Mhm.
and these are the natural aromatic presentations.
Mhm.
Not require an artificial. Today we have all deodorants, etc. and all. That's again what you call as again modernized in terms of presentation or preserved, etc. But
Right,
natural is always natural. So
right,
Ayurveda is always towards the nature. Okay,
right, right.
because we don't know what is the after effects.
Mhm.
I'm not studied enough that if you use a deodorant and tomorrow it can be a cancerous agent. We don't know. I'm not saying yes or I'm saying no.
Mhm.
So it can be and a question mark.
Mhm.
But we have not seen that wearing a garland and leading to a cancer.
Right.
Okay, because it's our tradition and time tested information is available with us. So
Got
I
it.
always goes with the nature. Okay,
Mhm.
a precautionary.
Mhm.
But moving with the what you call as presentation for the present day or convention, making more conventional, we can
Mhm.
have some aromatic essences.
Mhm.
Okay, room fragrance essences. So
Mhm.
that can be added. That can
Mhm.
be an added feather rather than should not spoil the integrity of Ayurvedic base oils.
Correct. 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 Yeah. Thank you. With regard to the course, I wanted to, I mean, it's my understanding that this course has to be a residential course. Am I right about that? I mean, and you have some time constraints. Some things have to be done in the morning. So there are, Ayurveda has prescriptions for learning and doing things at early hours in the morning or late in the evening or whatever. Will you explain the principles related to time in Ayurveda?
Yes, thank you for that. That's a wonderful question because this is a training program like any other training program, but it is not like any other
Mm,
because this is a different profession.
mm.
Even in the hospitals, also, doctor has a visiting hours, but the therapist has a fixed hours.
Yeah,
Okay, because therapy starts at morning 5 or 6 itself.
right.
Because as you rightly mentioned, some treatment has to be done in an empty stomach,
Mhm,
and some treatments is after the meal.
mhm.
Some treatment has to be done before you sleep.
Right.
So the therapists are with the patient in the hospital. So
Mhm.
they have to be staying. They have to be resident. Since
Right.
the profession itself is a resident, the
Mhm,
training as a trainee also should experience that feel.
mhm,
And since they are the learners by the shadow of the seniors,
mhm,
they have to be following the seniors and they learn better by following the seniors. They have
mhm,
to be the senior therapist.
mhm,
Their timing of training is also across the day.
mhm,
So they have to be in part with the treatments happening in the morning 7.
mhm,
So if they are day scholars, then they
mhm,
come at like a day hours, like 9 o'clock to 5 o'clock.
mhm,
Then they will be missing some trainings, special procedures.
mhm, mhm,
Hence, we make a mandate to stay residential. They can
mhm.
stay nearby, or if they are accessible nearby, they can stay by their home and they can be moving across. Or the training centers with our unique model of vocational training, we have centers across the across the various places. So as a student need not to be coming to the university, they can go into our skill knowledge partner, where there is internships or the apprenticeship is being posted. If they are accessible 4 to 5 kilometers nearby, then they can come in the morning without any difficulties. They stay at home. But
Right.
preferably, if they are resident at the place of the training, like in a university, we have a wonderful hostel facility and in-house canteen services. So they can stay at our hospital premises or the
Mhm.
university premises and learn better.
Mhm. Thank you for that. Is there anything that else that you would like to tell our, prospective students or their parents about this course? And given your extensive experience of delivering this course to over 1,000 students, I mean, um, how are they doing? I believe you keep in touch with all your students, isn't it? No matter when they passed. Tell us a bit about some nice relationships and some anecdotes of your interactions with them or something like that. That would be lovely for parents to hear.
There are many case studies. If I unwrap it,
Yeah.
so there are many. See, I have seen people, the students from a very very challenging backgrounds. Okay,
Mhm.
so their family, the siblings of 4 to 5 people, they are not much education support from the parents, and once they come to this program, they look at this as a wonderful opportunity, and they excel. They continue the journey of their life. They support back the family, and
Mhm.
family feels proud of it. Okay,
Mhm.
so many such examples are there. A girl from the I give you one example. A girl from the tribal population from remotes of the Dharmpuri, where
Mhm.
in Tamil Nadu.
Mhm.
Okay, she has come and learned this course, and now with her husband, she is in Bangalore, and our lifestyle itself is changed from a tribal person of
Mhm.
no much exposure to a civilized, or not civilized, I'm saying, and to the contemporary urban,
City and
urban
urban life, yeah.
urban life. Now they have come, and I think definitely next generation she can give a better education.
Correct. Mhm.
So the change in the cultural shift is being seen.
Mhm.
Okay,
Mhm.
this is one. And I'll give you another example, very very heart touching examples. I think, just to be on a record as well. Okay, I think re-verified from the fact, whoever is hearing to this podcast later, they can revisit the information. We have been doing the training program as partly sponsored by the OSDA, Odisha Skill Development Authority, for
Mhm.
many years, couple of 7 years almost.
Mhm.
And since this is a Odisha state sponsored, Odisha domicile students are eligible with an eligible bracket of 18 years to 32 years only, means the youths. Okay, and we have interacted with we have trained many such people, are more than 800 plus
Mhm.
students from Odisha we have trained.
Mhm.
So when I visited one of the place remote corners of Odisha for some other project as well, I've seen youngsters with not more than 15, 16 years are exposed to alcohol addictions. I've
Mhm.
seen people, and they are also tambaku, gutka addictions. I've seen the toddy, which is just 10 rupees accessible to them. Okay,
Mhm.
they consume it. And I have heard stories of the girls with just 15 years having abortions 2 to 3 times.
Mhm.
And there are some tribal practices where the boy can bring a girl from other family and keep her with him for 1 year, and then he can say, "No, I'm not interested more."
Mhm.
Okay, there are some maybe other. Why I'm telling at this context means students, children from that background has come to our training,
Mhm.
undergo this training. Now they have shifted completely,
Mhm.
and the next generation is no more will be with praying to the God, that no more will be such alcohol addictions or tobacco addictions, or the girls at minors will not be having such challenges in the
Mhm.
community of facing such a health hazards.
Correct. Mhm.
So this not only this program, many program can lead into such reformations.
Mhm.
But I have seen
Mhm.
just 6 months training from a zero earning to at least more than 1 lakh to 2 lakhs in a year per annum.
Mhm.
6 months training from a zero to 2 lakh per annum scale.
Mhm. Mhm.
A unique program which is 100% employment, 100% repayment with the food and accommodation well taken care. Because
Mhm.
I said this profession requires stay in the hospital. The
Mhm.
employer will give the free food and accommodation
Mhm.
plus at least, as I'm mentioning, 1.5 to 2 lakh per month per annum
Mhm.
CTC.
CTC.
So that's the key benefit of this program.
Mhm.
Many stories, which even includes one of my student was saying after 1 year, 2 years, when I called him just to say hi and all inquiring, he said, I asked him, Abhi kitna kama rahe ho? What is your salary now? He
Mhm.
said, salary पूछो नहीं, मैं tips में ही 2 लाख बना लेता हूँ. By,
Correct.
by tips itself, they are making around 1.5 to 2 lakhs per annum.
Yeah. 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 Yeah.
So that see, not all professions are giving you the tips.
Mhm. Correct.
As a doctor, I don't take tips. Okay, I charge my fees. Okay, but these are and this is not something which is bad. Also, no, it is not
No,
like
no, not at all. Yeah.
it
Yeah.
is something which is the feeling happy and giving.
Correct.
It is like what you call incentive or like honored, being honored. Okay,
Yeah.
so in that in that it's not like a dan. Also, it's not a dan.
Correct.
It's not
Yeah.
some charity they're giving. They're happy and they're giving it. So
Correct.
it is an incentive in a different form,
Yeah.
which is motivating
Mm.
and unsaid,
Mm.
undocumented
Mm.
blessings.
Right.
These people will get.
Correct.
Okay, I'm proud of being a Ayurveda doctor.
Uh,
My parents has received much informations and much gratitude thanks
uh,
from my clients.
right.
They said, like, your son has an healing hand. It's not to boost myself.
Yeah.
Like me, there are many such Ayurveda physicians,
Right.
okay, who are doing their job with their possible extent.
Right.
And apart from my consultation, I get blessings.
Correct. That's fantastic. That's such a lovely feeling, actually, and
Yeah.
it's the gift that physicians who kind of when patients are in trouble, they are ill, you help them and you get their blessings. That's really beautiful, actually. I don't want to let you go without commenting on one last thing. You have also been, a big part of the skill development effort in the country, isn't it? You prepared curriculum for the Ayush Ministry. Tell us a bit about your work on and the overall perspective on vocational education in Ayush in the country. You've
Ah,
done some work, yeah. I think you have prepared the curriculum for
no, yeah,
national level, isn't it?
yeah. I'll tell you briefly on that. Okay.
Mm,
It is a compiled work. Okay.
mm,
So when we means again the TDU FRST, that we were started this Panchakarma course
mm,
under the skill ministry or skill sector.
mm,
There was no trade name of Panchakarma therapist.
mhm,
Okay, so around almost 7 8 years back, or maybe 9 years back or so, if I remember correctly. So we wrote them to the Health Sector Skill Council (HSSC) that please include Panchakarma therapist, and this was instrumented or initiated by Dr. Balu Balasubramaniam from SVYM. Okay,
mhm,
we both together discussed, and he was a person who wrote the letter to them.
mhm,
He
mhm,
backed them,
mhm,
and then once they approached us, we also contributed. It is not
mhm,
like we did it; we
mhm,
also contributed to part of the curriculum. But
mhm,
they, Ayush department, they also collected information, collectively informations, and they have developed it. So it
mhm,
is the HSSC developed, but we as our contributions, we are the initiator. That's what we
mhm,
can
mhm, mhm,
go with, and
mhm,
we could contribute to whatever the extent. And
mhm,
so we are following in line the curriculum as guided by the Health Sector Skill Council,
mhm,
Ayush schemes.
mhm, mhm. Got it. Yeah, 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 yeah. So are there many other places that are offering these kind of therapies? Where do we compare with all of them?
As you all know, the motherland of Ayurveda, what we call Kerala, wherein God's own country,
Right.
and Ayurveda is very evidential, very homely. Every house practices Ayurveda in either way, some medicines or some practices way. That's how we look at Kerala.
Mm.
Kerala, there are many institutions which is doing this Panchakarma course, and mainstreaming them. There are some certifying body, which I call not agency but body, uh,
Mm.
which are giving the diploma programs.
Mhm.
So we are in focus on and we are striving to be better in terms of curriculum and delivery
Mhm.
than our colleagues or the peers. Okay,
Mhm.
there are some other places in Bhubaneswar. There's one health village is one organization which is also training in a smaller capacities. Uh,
Mhm.
and maybe in other places also like Haridwar, maybe having some.
Mm.
But what uniqueness we bring in is
Mm.
we are a university. That's the first thing. It
Mhm.
is guided by governed by the academic council,
Mhm.
academic research council, and the
Mhm.
board of studies. And
Mhm.
it's been streamlined by the experts,
Mhm.
and curriculum is tested every time. And
Mhm.
in larger scale,
Mhm.
since we have our hospital, which is again IAIM, which I'll put two words about integrations, which I wanted to elaborate. So hospital which is very supportive for the training environment, because not all private hospitals support the training facilities.
Mhm.
So that uniqueness brings us capabilities to train at least 250 students. We have experience we have trained in a year,
Year. Mhm.
so which we wanted to gear up more
Mhm.
with the requirement of industry.
Mhm.
So we are the one pioneered
Mhm.
in this training, delivering from many years,
Mhm.
and delivering the best quality in terms of the skills.
Mhm.
Okay, and employment, because we have a huge network. Employment is 100% assured or successful
Mhm.
employment, and follow-up of the employment also. That's a uniqueness with us. Is typical tell you, I did my bachelor's and master's. My college has not taken any responsibility to get me a job. Okay,
Mhm.
that's one of the colleges too, right?
Mhm.
I'm not blaming or anything. I'm very privileged to have been one of the alumni of the government or medical college, which is a very esteemed and old college. But as a mandate, there is no mandate that they should get me a job, correct?
Mhm.
But we are doing with our students. We
Mhm.
we have made our internal mandate that we will help them to get a job. Not only
Mhm.
first job, we have made second job, third job, fourth job also for our students. That's
I
how
see.
alumni are still a connection with us. So
Right.
that's a very unique position what we have taken in this field, and
Mhm.
which I don't see any other institutions which is doing this as a protocol.
Got it. That's brilliant. And actually, the fact that you are finding second, third, fourth jobs, this your students are still connected with you long after they have gone and have living independent life. It speaks volumes about you and the way you train and the way you keep in touch with them. It's empathy of the kind that of the best kind that is we our country is known for. Thank you very much, Dr. Girish. I think this has been a fascinating conversation. I have also learned a lot. Thank you.
Yes, ma'am. Yeah. Lastly, just I wanted to remember and elaborate on IAIM stands for Institute of Ayurveda and Integrative Medicines.
Right.
Okay, it's an institute. That name itself says it's not an hospital. It is
Mhm.
an institute which is
Mhm.
wanted to teach,
Mhm.
okay, or demonstrate. That's the one thing.
Mhm.
Okay. Second, of Ayurveda and Integrative Medicine.
Mhm.
So wherein Ayurveda is the main platform, it is integrated with other system of medicines.
Mhm.
Wherein currently we have at our hospital is the along with Ayurveda Panchakarma, we have the physiotherapy, acupuncture, acupressure, yoga, varmam, and
Mhm.
need-based allopathy. So we have a full-time allopathic doctor. So these are current integration. We can integrate more as well based on the expertise coming into it.
Got it.
What is this integration? It is judicious delivery. I will use very, very carefully that judicious means timely, what at that time, what is justice. Okay, it is not like I want to give you some yoga, I have to give you some yoga and also give you some medicines. No. If yoga is required, then only we give the yoga. If medicine is required, then only we give the medicines. If required for injection, we'll give the injection. But under the supervision of an allopathic expert. Timely delivery or a judicious amalgamation of integrating the multiple disciplines.
Right.
Benefit of the patient. That's what integration. That's how we practice. And this hospital is started in 2010, and it's been almost again 15 years or so. It is wonderfully doing, which is again well maintained, cleaning, hygienic, clean, etc. and all, and also delivering for its best. That's how it's an NABH accredited hospital. So that's about the IAIM, and the full name is IAIM Healthcare. Again, we are not mentioning as a hospital; it's an healthcare, both illness and wellness. So we are the person who call, if you are healthy, please come here. We'll make you more healthy. None of the hospital do that. None of the hospital call you that you are healthy, please come here. No, they say you are diseased, please come here. We say reverse. We are healthy, come here. We'll make you disease free or disease resistant.
That's amazing. Amazing. Thank you very much.